Hi, my name is Dr. Jeff Berg, and I'd like to talk to you a little bit about meniscal tears. Meniscal tears are a common cause of knee pain, and I thought we'd talk a little bit about them, including the anatomy of what a meniscus is and what a tear is, how you might get one, what the symptoms could be, and a little bit about the treatment. So, a meniscus. The meniscus are two C-shaped discs inside the knee, and they sit between the femur bone, the thigh bone, and the tibia bone, the shin bone. And these little things here are the meniscus. And if you look, they're C-shaped. And what can happen, usually in the back, you can get a little tear of that. And a meniscal tear is just that. It's just a crack or a rip in the meniscal structure. These meniscus, when they're healthy, will usually work as shock absorbers, protecting the surfaces of the knee joint, and also provide some stability and other functions. When they tear, however, that piece flips around and it irritates the lining of the knee, which you don't really see on this model. And that lining of the knee gets inflamed, not unlike when you have a hair in your eye and your eye gets inflamed. And so that causes some local pain in that area. In addition, the lining of the knee will then produce fluid. And the fluid in your knee has nowhere to go because the knee is a closed space. So it builds up and it causes pressure, which causes more pain. And then it can also cause stiffness. And finally, the meniscus tear piece can flip around back and forth and cause a catching or clicking sensation. And in fact, sometimes you can get a large tear called a bucket handle tear, in which the piece in the back flips to the front, and it gets stuck in there, and you can't straighten your knee. And these are significantly painful. Now, meniscal tears can occur in a number of ways. In younger active people, they usually occur with a relatively significant trauma, typically on a sporting field or some activity like that. There's usually significant pain, sometimes an additional injury to the ligaments or other parts of the knee. As we get older, the meniscus is softer. It's not as firm as when we're young. And so these can occur just simply with everyday activities. And a lot of times you won't even notice that you tore your meniscus until the inflammation and swelling starts to set in these kind of cases. In regard to diagnosing, most of the time a simple office visit we can detect a meniscal tear. The history is pretty common, where the symptoms are, and a physical exam. And usually we take an x-ray and confirm there's no significant arthritis, and we can almost always make a proper diagnosis. However, it's not uncommon for us to get an MRI of your knee to confirm that diagnosis. And MRIs are very good studies for looking at the meniscus. In regard to the treatment of meniscal tears, in some cases, in an older, less active patient, as I mentioned, the meniscal tissue can be softer. And sometimes, even though these might be quite symptomatic, with a course of rest and anti-inflammatories and sometimes some physical therapy or a home exercise program, we can get the symptoms to settle down and in fact go away. In a younger or a more active patient, that's unlikely to happen. And these patients typically require surgery. And the surgery performed is called an arthroscopy. And an arthroscopy is a procedure done typically as an outpatient with a small instrument the size of a pen. And then that instrument has a camera on the end of it, which we can slip through tiny holes in the knee. And we can look all around your knee. And typically we do what's called a meniscectomy, in which we trim out the torn piece of the meniscus. We just clip out the torn piece so it's no longer bothering you. And over a small period of time, those symptoms will resolve. In some cases, the tear is of such a configuration and in such a location that it has a chance to heal. And in those cases, we can place sutures across the tear and get the tissue to heal. And that's called a meniscal repair. So that's a little bit about meniscal tears. I hope it's been helpful. If you'd like some more information, you can go up on my website at jeffreybergmd.com. And there's some arthroscopic videos, some pictures, and some posts that I've placed up there that I think you might find helpful.